We are now on Module M, which is the nursing process and the nursing care plan. So I'm going to give you a heads up. You do need to understand what the difference is between the nursing process and the nursing care plan for your test. And they sound so similar. I get it. People always get them confused, which is why I want to point that out. So when we're talking about the nursing process and the nursing care plan, we're going to define what that process is, why you as nurse aides have such an important role in the nursing process. We're going to talk about Maslow's hierarchy of needs, which plays a role in this process and plan that we do. We're going to talk about the nursing care plan, its importance, and also your role in the care plan itself. So the nursing process. This is a method used by nurses to plan and deliver nursing care to the resident. There are 5 steps to the nursing process, and you want to know these as well. The 5 steps are assessment, planning, implementation, evaluation. What did I miss? Assessment, nursing, diagnosis, planning, implementation, and evaluation. Sorry, I was like, I missed one there. So assessment, when we're talking about assessment, this is the collecting of information about a resident, which the nurse obviously is going to do, but this is where you're going to have a huge role, is the assessment part and collecting information about the resident. The nursing diagnosis, this is a diagnosis that can be treated by a nurse with the help of a nurse aide. It describes a health problem, and that we create different measures and goals and evaluate to see if those problems are being solved. This is different than a medical diagnosis. So I am a registered nurse. I will not give a patient a medical diagnosis, but I can give them a nursing diagnosis. And if you move on to nursing school, this is something you're going to be doing a lot of. So again, it's a nursing diagnosis is something that can be treated using nursing specific measures. Planning is setting priorities and goals for a resident. Implementation is performing and carrying out those nursing measures that will impact our residents' care. And then evaluation is measuring to determine if priorities and goals were met. And if not, we need to reassess and reevaluate, okay? Let's see. So the nursing process is based on the individual needs of a resident. It's used to support directives given from the doctor and other members of the healthcare team. So it all works together, of course. The importance of the nursing process is that it helps to organize our care, it helps to individualize our care, and make sure that it has a purpose, that we're working towards goals and accomplishing them. The nursing process also helps to make sure that care is consistent, right? From shift to shift, from nurse to nurse, and from nurse aide to nurse aide. When all of this is happening, it also helps to make the resident feel safe and secure, and it assists all healthcare team members to deliver care. So let's talk more about our role as nurse aides in the nursing process. We assist the nurse in collecting information through our interactions with the resident. For example, obtaining height and weight, vital signs, recording intake and output. We encourage the resident to participate in meeting whatever goals were set. And we provide care that is determined to positively impact the well-being of the resident, such as turning and repositioning, helping with toileting or activities of daily living. And also, we're reporting these observations to the healthcare team to help determine if the priorities and goals that we set were actually met. So our documentation, when we do it accurately and thoroughly and in a timely manner, that's going to help our nurses with evaluating interventions. So did that intervention work? Did it not? What can we change? So nurses rely on our observations as nurse aides to assist with that evaluation. So the most important role we have as nurse aides, again, is to accurately report reactions to interventions, observations that we're making about our residents. And again, if it doesn't work, something's not working, the nurse is going to modify the nursing care plan. So we're going to jump over to Maslow's hierarchy of needs for a minute. If you've taken any psychology classes, you've seen this before. So Maslow's hierarchy of needs is used to assist nurses in prioritizing and developing a plan of care with patient-centered outcomes. And we're going to talk more about patient-centered care later in a later lecture, but patient-centered outcomes is, again, it's specific to that resident, okay? So this hierarchy, what this is basically saying is that you see the physiological needs at the bottom of this pyramid. So physiological needs are things like water and food. If my need for water and food have not been met, then I cannot even move on to meeting my needs for safety and security. Okay, so let's talk a little bit more about some examples. Physiological needs, like I mentioned, that's like food or water. It's also toileting, breathing, circulation, so our vital signs, getting adequate sleep, exercise, sex, shelter. Those are our physiological needs. Safety and security needs include, being safe from injury. Things that we can do as nurse aides to aid in that is making sure that our residents have their call bells, that we're using fall precautions appropriately. Or if they use an assistive device, make sure that they can use it appropriately. Safety and security also has to do with building trust, which, as we've just learned in previous lectures, we build trust through communication and empathy. This is also ensuring cleanliness in a safe environment. And we can do all these things as well by educating our patients and our residents, or patients and our family members. So love and belonging, some things that fall into that tier of the pyramid. These are supportive relationships, therapeutic communication, and again, going back to more meaningful relationships. So as healthcare providers, we want to build meaningful and trusting relationships with our residents. And this is for many reasons, but it helps on that level, it helps to give our residents a sense of love and belonging. Self-esteem, that's when we feel accepted. We feel a sense of control or empowerment over um, our own bodies, our own mental well-being as well. Self-actualization. This is a good way to describe this may be like spiritual growth. It's able to feel that we've met our maximum potential, okay? So as we go through life, we might, get up to self-esteem and then something goes on in our life that knocks us back down to physiological needs, right? So we go through this pyramid up and down at various times throughout our lives. But what's important to take away is when I'm trying to prioritize my care for my patients, if their physiological needs aren't met, I can't jump up to love and belonging, okay? Does anybody have any questions about that or any comments or feedback? Okay. Let's see. All right, so let's talk a little bit about the nursing care plan. So the nursing care plan, again, is the responsibility of the nurse. So we use the nursing process to create a nursing care plan. And I'm going to repeat that because that's what's going to kind of just stick in your head to remember what the difference is. So the nurse uses the nursing process to create the nursing care plan. The nursing care plan is going to outline the individual priorities and goals established for that particular resident. You may see this on a care desk, it may be on the computer somewhere, or you might have a written care plan. This form, the care plan is going to include, again, these goals that we have, specific steps on how we're trying to meet those goals. And it's going to be kind of a good summary to look at what's going on with the patient. Depending on where you work and if you go on to be a nurse, this is something that you're signing off on each day at the end of your shift, stating whether the goals were met, were they not met, do I need to add any changes? So that's where, that's what the nursing care plan is and where we get it from. Your role in the nursing care plan, again, this goes back to the process, to the nursing process, is to assist the nurse with collecting data. And we do this because we work so closely with our patients and our residents. And we have to use all of those observational skills. Reporting how the resident responds or reacts to interventions. If they don't work, we need to let them know. We need to accurately report our residents' reactions to interventions. And just keep in mind how important our role is as nurse aides, and that nurses are relying on our information to care for our patients and to update this process and care plan. So care of the resident is a process that, excuse me, constantly changes. It requires teamwork, effective communication, accurate observations, and detailed reporting. The resident's health and well-being are dependent upon the entire team. Does anybody have any questions or need any clarification about the nursing process or the nursing care plan? Okay, I'll take that as a no. So that's the end of that lecture. It's really, really quick, but it's really important. I'm going to hit end